I wanted to just briefly talk about some interventions for these side effects that are related to treatment, and then I will open the floor to questions because I have been blabbing on for 25 minutes already. Specific interventions are really related to the type of cancer and the treatment. Things like depression and anxiety are often treated by the new antidepressants and anti-anxiolytics. These medications, however, have significant sexual side effects as well, and really can decrease desire and cause problems with arousal and orgasm, which can just make things worse. Dealing with fatigue is a challenge, as many of you know. One of the most effective interventions we have for fatigue is exercise. However, that really does sound like an oxymoron. I'm so exhausted. I'm having difficulty coping. How on earth am I expected to exercise? But it really does help. The changes associated with loss of ovarian hormones can be dealt with, of course, by prescribing hormone therapy, but this is obviously not going to happen if the cancer is estrogen dependent. Local estrogen in the form of creams or pessaries or estering the ring is very, very, very effective in treating vaginal dryness and pain. And the first step usually, though, is to use something called Replens, which is a vaginal moisturizer, which is used 3 times a week, which can really help alleviate the burning and itching of vaginal and vulval tissues. It is not a lubricant, though. If you are lacking lubrication for sexual activity, you really do need to be looking for a lubricant, with either one which is water, silicone, or glycerin-based. Please don't use anything that has dyes or perfumes. Don't use anything that is oil-based, scented, or not specifically designed for sexual activity. For example, hand lotion really doesn't work. Women with vaginal dryness frequently experience pain with any attempt at vaginal stimulation. This creates muscle tension, and really what can happen is the woman can then fall into a cycle of what we call vaginismus, in which every time anything comes anywhere near that part of her muscles tense up, and so any touch causes this reflex response to the anticipation of pain, and it is a cycle that can be quite difficult to break. There are ways of learning to relax vaginal muscles, much the same way as we teach women to do Kegel exercises, and there's a way of using relaxation with the same muscle. You really do need, though, a multimodal approach to dealing with these problems, and really this is something that someone like I, a sex therapist or sexuality counselor, can work with you and try and make some changes through these interventions. So, Fran, if it's okay, I want to stop now and open the floor to questions.
We have a question or comment from Julie. Please go ahead.
Hi, Judy.
Hi. I'm just have a specific question. It's been since my surgery in 2004, and soon after I was feeling well, was getting sexually active again. I didn't have any problems with libido or anything, but when I'm being sexualated, stimuli sexualated, what am I trying to say? I can't.
That's okay. I think we've got it. We're sexually stimulated, yeah.
There is some bleeding that I didn't have before my surgery, and I'm just wondering if you knew whether that was because of this surgery or cancer, or if that's something totally, it's not a lot, but it's almost all the time.
Do you have vaginal dryness, Julie?
Sometimes we use a lubricant.
Mm-hmm.
Yeah.
First of all, I don't want to make a medical diagnosis on the phone, but it sounds to me that this might be from vaginal dryness, that you might have, even a minuscule little crack in the vaginal tissue that is causing a little bit of bleeding. So, I think that, I'm pleased that this is not causing you a problem on a daily basis. Let's be thankful for small mercies here.
Right.
But I think that you need to look at, first of all, ensuring that you're using adequate lubrication during sexual activity. What are you using for lubrication?
It's just a tube or something. My husband works at the hospital.
Okay, so he took some KY jelly or the equivalent there.
Yeah.
I mean, I must tell you that I'm not a huge fan of KY jelly for sexual activity, and I'll explain why.
Okay.
It tends to dry out quite quickly, and I don't know if you've had this experience, but sort of with the friction of sexual activity, it dries out and kind of gets gummy, and then you're picking out little balls of the stuff out of your pubic hair. So, it might not be adequate for you. A product that I highly recommend is something called aStories. And I just want to say at the outset that I have no financial interest in this company at all. aStories is actually a glycerin-based product. You can get it at the drugstore. You can even get it in sort of the drugstore department of your local supermarket. It's very, very slick.
Okay.
It doesn't dry out. It's perfume free. It's dye free, and a ton of people use it who aren't having any issues because it just enhances the experience so much. It stays slick for a really long time. Just be really careful with the amount you use because we don't want you sliding off the bed and onto the floor.
No, we don't. Okay.
So
much.
use less. Yes, so try that. I mean, the other thing that might help you, of course, is local estrogen, but that's something that you need to talk to your physician about.
Right. All right. Okay. Thanks a lot.
Okay.
I just wondered if that might be related. Thank you.
Okay.